We also have Awa on the call today. She is going to talk about a couple of the components, as well as I will talk about a couple of the components. Um, and we'll start with the mission. Um, what we do is we help residents gain access to supportive environments for healthy eating and physical activity. And the goal is to make it easier for health and fitness to be a priority for all residents and empowering them to lead longer, healthier, and more fulfilling lives. So these are the five components or programs that Safe Routes to Health has resources on and has done in the past. Although this year, due to COVID, is a little different. Um, Beaumont only chose three of these components to support, um, but the other two we can talk more about if anybody has interest in. We have resources. So health through literacy is not one of the components. Actually, I'll go back. I didn't tell you which ones. So the ones that Beaumont is supporting are Fresh Conversations, Farmers Market Food Navigator, and Get Active. So Health Through Literacy is a program that was developed by Michigan Fitness Foundation and was created as a way to teach young people simple health messages through the use of high quality children's books. Um, Due to COVID, since Health Through Literacy is normally like organized readings at a local library, um, can't do that. But like I said, if somebody has interest in this, I think we have resources that we can pass along. And Awa knows more about the Fresh Conversations piece. Awa, did you want to talk about that?
Yes, hi everyone. Okay, so I'm going to talk about the Fresh Conversations program. So the Fresh Conversations program is a program that was created by the Iowa Department of Public Health with funds from the SNAP Ed program. So this is targeted towards adults, low income adults age 60 or older. So the goal of the program is to encourage and support older adults to maintain good health and independence. So what goes on in these fresh conversations is that the facilitator will take a few topics, and this will be divided into 8 sessions. And each week there will be a newsletter where the seniors will gather and talk about these topics in order any to learn about these health topics or any tips or anything like that, to make sure that they're learning how to take care of themselves. And yeah, that's all I have for that first conversations.
Cool. And then the Farmers Market Food Navigators. Did you want to talk about that too, Awa?
Yeah. And then so the Farmers Market Food Navigators is a program where food navigators work in these farmer markets, and they help shoppers have access to local and healthy food while maximizing food dollars. So not a lot of people are familiar with farmers markets. So these food navigators are trained to walk shoppers and consumers through the markets and help them choose easy choices to healthy foods. um, yeah, yeah, they're here. Um, help them access healthy food options. And they also conduct community outreach to build awareness on the farmers market and food assistance benefits like EBT. And so in the farmers markets, food navigators also help shoppers taste new recipes and learn strategies so they can be able to help their families have access to those fresh Michigan grown produce. Yeah.
So Cooking Matters program is also one of the ones that Beaumont did not choose to support, but still we have a lot of resources on it. And there is also a way to do this without being in the store, because normally Cooking Matters is a program that is in the grocery store, like a 90-minute tour. But there's virtual materials to do this via Zoom, and there's also a pantry version. Um, and Cooking Matters has also created 8 online classes that can be one-off presentations or used in a series. So I don't really know a whole lot about it, so we haven't talked about it much, but if anybody is interested, we can get more information on it. So the Get Active component works to share their community's inventory of recreational resources with the residents, organizing free to low cost excursions relevant to the season and local opportunities to get people out of their houses and being active in a social setting. This could include hikes on wooded, urban, or in-town trails, winter walks at the mall, touring garden areas or nature preserves, ice skating at the arena, kayaking on the river, much more. So that's what was listed there, but it could include anything that the community offers. So think what is specific to the Dearborn community. The priority population for this component are low-income adults and families in the communities. So knowledgeable volunteers are recruited from local community groups to lead events that are community relevant and informative and highlight local physical activity opportunities. Now the Reconnect component that is included up there is a component that provides best practice physical activity education and information while employing a collaborative community approach that exposes community members to a tasting to sample physical activities. So they call them physical activity tastings. They're demonstrations that are judgment-free and presented in a way to allow all participants to take part. And they want people to try different and new forms of physical activity to find something that they love to do. So that's what this Get Active Reconnect is all about. The tastings can take as little or as much time as you'd like. They're like 15 to 30 minutes, and each topic has a corresponding instructional sheet that we have that provides information on how to prepare for it and implement the PA tasting. So yeah. That's all the components that we wanted to talk to you about. Is there any questions, or sure we're gonna have a nice little discussion?
Thank you, Jake and Awa. Are there any questions? We'll make sure that this PowerPoint is available as well. And we are sharing these programs with all the other action teams as well. So, there could be opportunities for multiple action teams to work on certain programs, but I think there's a lot of built-in systems and programs that already exist that a lot of these programs could supplement moving forward. Ideally, we would like to have like the next 2 to 3 months to kind of plan and look at, what are some community partners that maybe we don't currently work with, that we could work with on this, as well as our existing partners through the coalition. And then in the spring and summer, roll these programs out. We have Jake and Awa hopefully until the end of the summer, early fall, but it really depends on the number of hours that they get in. So they might finish a little bit early, but hopefully we'll have them until at least the middle of the summer.